the Texas sun can take a toll on our skin, but you don't want that toll showing up at your holiday parties. There's a way to erase those patchy brown spots and telltale signs of aging. You'll be the belle of the ball. Please welcome dermatologist Dr. Suzanne Bruce and Dr. Polder with Suzanne Bruce Associates. Hi there. Technology has gotten amazing, especially in the area of lasers. It used to be they could be pretty tough on your skin, but now it's just much easier to deal with. There's the Fraxel laser, but then there's the Fraxel Dual. So what's the difference between those two?
Okay, this is the newest generation resurfacing laser. So the first Fraxel came out in 2005, which was a great laser for resurfacing the skin, working on wrinkles, brown spots, pores, acne scars, texture. And then just in the last few months, they've come out with the next generation Fraxel called the Dual. And it actually has 2 wavelengths in one machine.
Wow.
So we can decide, depending on what the patient's condition is, whether we want to target more brown spots or target more wrinkles or both or melasma. So it gives us much more versatility in how to treat patients.
Right. All right. Let's talk to the audience here. How many of you have something on your skin that didn't start with you? Like all of a sudden, all of a sudden you look up one day and go, now what is that? Okay, so let's go down the line there. A lot of people deal with brown spots. What causes those?
The sun, the Texas sun, just like you said in the intro. Over the years, the sun causes brown spots and it breaks down our collagen, which is why we get wrinkles and sagging.
Yeah, and on those brown spots, it's interesting because a lot of that happened when you were very young, right? In your earlier years,
right?
And it comes to the surface. All right, so how do we get rid of those? How does this work to get rid of those?
So over here, Dr. Polder is working on our patient Candy. Candy's already had one of these treatments a few weeks ago, and we got a lot of her brown spots off in that one treatment.
Wow.
And now we're going to be targeting more, working on wrinkles, texture, pores. So she's going over the face with the laser. We've had numbing ointment on for about an hour to make it nice and comfortable for the patient. Then the machine also has cold air blowing on the skin, so that helps keep the patient more comfortable.
Yeah, because the laser's warm, right?
Yeah, so you feel the heat, but the cold air is dissipating the heat and keeping the patient comfortable.
Okay, patient, is that comfortable? Can you raise your hand for me and tell me if that's comfortable?
You doing okay, Candy?
She's like, I'm doing okay. All right.
She's alive.
Melasma, that's, explain what that is. I think sometimes it happens when women are pregnant and it can go away, but sometimes it doesn't go away.
Yeah. Melasma is the big brown patches that women can get from hormone changes. So pregnancy, birth control pills, estrogen, and it's a combination of the hormones and the sun exposure. So it's always been notoriously difficult to treat, but now with this new laser, we have another tool that can help us treat the melasma.
Okay, and the other thing is acne scars. There's so many people battle with acne, and then once that's gone, there's the other battle, and that's the scars that are left behind.
Exactly. So this is a great laser to help resurface the skin, and when we have those sunken in areas, building the new collagen will elevate those scars and bring them up and make them more smooth and less depression.
And Dr. Polder, tell us a little bit more about the machine. I heard that little thing go, beep.
Right.
What is it telling you to do?
So that little tiny beeping sound that you hear means that we're actually treating. And then this is an interesting machine because you can actually change the wavelength of the laser with just a touch of a button. So if I go to the home screen here,
and of course you determine the wavelength by what you're actually
trying
treating.
to target. So if it's more wrinkles and acne scarring, we're treating with a 1550 nanometer wavelength. And if it's more brown spots and melasma, we're using the 1927 nanometer wavelength.
And that is why you're a doctor.
Change it like that. It's very simple. You just change it with a touch of a button.
Yeah. So. All right. So once you get this done, are like those brown spots, for example, is that gone for good? Or is there other stuff that will resurface over time because of the damage that's been done to the skin?
Over time, we may continue to gradually get more brown spots as we age. But if you're really good about using sunscreen, that's going to help slow down new ones from coming. But some people may have to come back in a few years and do more treatment because we're going to keep aging.
Okay. And in wrapping up, you've basically taken care of most of our problems with this one machine. But what other things do you all do?
Well, at our practice, we do the whole gamut of dermatology. We do fillers and Botox and lasers and leg vein treatments, hair removal, pretty much from A to Z.
Yeah, I love the leg vein treatment and hair removal. Well, that's what I love about fall is because you can have these boots on, and ladies, you don't have to shave until March. And so we'll see you in March. All right. Dr. Bruce, thank you very much. Dr. Polder, and thanks to our patient here who agreed to come on and have that performed live on the air. You can learn more at the Fraxel Dual Power Lunch this Friday from 12 to 1. And quickly tell us what that Fraxel Dual Power Lunch is about.
So at our office this Friday from 12 to 1, we have an informational seminar where you can come learn more about the laser, get an individual consultation, talk to the dermatologist, and see if you're a good candidate, whether you have something that we could treat you with.
All right, to RSVP and get more information on Suzanne Bruce and Associates, call 713-850-0240, 713-850-0240, or log on to SBA, there's a hyphen, skincare.com, SBA-skincare.com.